a couple of minutes for everybody to join the call.
Thanks, Dave.
Right, coming in thick and fast now.
Oh, wowzers, yeah, flurry.
Right, I think we're good to go. Good morning, everybody. Thanks for joining us on today's webinar with ukactive Strategic Partners CAWS. With the abundance of webinars you've got the opportunity to dial into during lockdown number 2, we really do appreciate you taking the time to spend the next hour or so with us. I'll shortly introduce the presenters for today, but before I do, just run through some housekeeping for the session. The webinar is being recorded today and will be available shortly after the webinar finishes, should anybody want a copy. Everybody's been muted on entry and there will be for the duration of the webinar. However, you do have the opportunity to ask any questions throughout today's session via the Q&A function at the bottom of your screen. The CAWS team will do the very best to answer every question that comes through. If for any reason you get cut off using throughout the webinar, please just click back in using the link you've used to get here so far. So my name's Dave Alstead. I'm the Head of Member Experience for ukactive. Delivering today's session is Mel Spooner and Dr. Col Robertson. Mel is currently the Managing Director of CAWS and has been in the industry for many years. I won't say how many, Mel, but she's worked with a number of well-known brands such as MyZone, Technogym, TPN International, FitPro, TRX. We could go on, couldn't we, Mel? Dr. Col Robertson. I could spend the next 45 minutes running through Dr. Col's academic and professional qualifications. However, that would leave no time for what you're actually here for today. I will say, though, that Dr. Col's been involved in human performance and sports science for his entire professional career. From his roles as a clinical exercise physiologist at Wrexham District Hospital to head of strength and conditioning at Liverpool John Moores University. He's also the co-founder of UTS Gym and UTS Foundation on the Wirral, which helps people who have had or are currently undergoing treatment for cancer, with a key strategy being that these people should not have to pay for or deal with any kind of barrier to access support, which helps them overcome the debilitating levels of physical fatigue which is left in the wake of surgical and medical treatments. He's also a member of GM Innovations Research Group, which is primarily focused on the reversibility of type 2 diabetes via exercise and nutrition strategies, cancer rehabilitation and prevention through lifestyle modification, and the impact of changes to diet and physical activity on children's well-being. So at ukactive, we first spoke to Mel and Col back in May during lockdown number 1, and since then we've worked consistently together with the aim to support our club partners as we emerged from the pandemic. We formalised a strategic partnership in October as part of ukactive's endeavours to overcome the effects that COVID-19 has had on the sector and the health of our nation, and in positioning the sector as a solution to COVID-19 situation during the current crisis and for the longer term. As a CIMSPA accredited training partner, we feel that CAWS are perfectly placed to support operators in providing the workforce with the tools needed to receive members of their communities who are recovering from the effects of COVID into their facilities. Throughout today's session, Mel and Dr. Col will introduce the beginnings of how to embed a COVID-19 and long COVID rehabilitation programme into your club. And that leaves me just to hand over to you, Mel.
Thanks, Dave. Thank you for the very kind intro to both of us. I'll also, before we kick off, introduce Chris, who's also, you guys should be able to see on screen. Chris is one of our CAWS graduates, and some of you may know Chris because he's been in the industry for a little longer than I have. So I'll introduce Chris later and he'll talk you guys through a few bits separately as well. But to kick us off, as Dave said, huge thank you everybody for dialing in. I know life is a bit Zoom life and webinar life at the moment, so we really appreciate you taking the time. And in today's session, we'll cover how to start to embed a COVID-19 and long COVID rehabilitation plan into your club services and communities. We'll provide a little bit of context beforehand. If you've been in presentations and sessions with Col and I in the last 6 months or so, some of the material will be familiar, but we have updated things So if you have been in previous sessions, then you'll find some new stuff as well that's relevant today. To kick us off then, to set the scene, as an industry, we've spoken a lot in the last few months about the role that we play generally in the promotion of good health and in the prevention of the worst types of symptoms that someone can endure if they contract COVID-19. But we've talked a little bit less about the role that we can play in the rehabilitation of someone from COVID-19 and long COVID, when in fact we can do both of those things really well. Carl is going to talk us through some statistics which speak to the size of the population of individuals who are currently trying to overcome COVID-19 and long COVID.
Thanks, Mel. Yeah, hi everyone. Yeah, it falls to me to talk through some of the kind of figures as to where we are in the present day. So as you will all be aware, undoubtedly back in March was the first version of lockdown, which was due to the increased prevalence of those cases that were coming through. And at that point, much of the narrative, particularly across the media, was focused with the mortality, the death rate. And we were looking at an increased set of cases, and therefore there was prediction with regards to how that would affect mortality. And we've seen that roll through much of 2020, taking us all the way through to July, where we saw that we had, the reopening of gyms under new guidelines. We're well aware, and I'm sure everyone on here is aware of the statistics regards to the safety and how well we can manage those environments. But we've come all the way through to our present day now. Obviously, there's been a tiered approach prior to now regards to lockdown, and currently the whole country is on a version of lockdown with the exception of Wales. But what we're seeing is, obviously, as we test more, we are seeing more cases. But more importantly, what we need to factor into this is that whilst we're seeing more and more cases, which is typical of the way a virus operates, what we're also seeing is a reduction in the overall death rate. To an extent, globally, the current survival rate is circa 97%, and actually has gone through periods whereby it fluctuates between 99 and 99.5%. But right now, the death rate is regarded at 3.7. So what we're seeing, as would be predicted by any epidemiologist, is that we are seeing more cases, more and more people are having to deal with COVID-19 and the symptoms therein. But as those numbers grow, we've got to recognise that there are less people per population overall who are at the most risk of the most severe outcome. So it speaks for itself that we will see over time that death rate come down. So that's a natural occurrence within the data. But what I want to draw your attention to, and reason why we're all here, is that more and more people are going to be infected with COVID-19, and more people are therefore going to need support with their recovery, restoration and rehabilitation. That's what COVID is in real terms. It's a condition, it's a virus that people contract that deal with whatever measure of those symptoms they are, but for the vast majority of people, it's then what happens in the wake of it. And we're now becoming more and more familiar with terms like long haulers and long COVID. And that actually has multiple meanings. We can interpret that in different ways. There are the long haulers, the people who've been in ITU, who've had to have respiratory assistance. So the trauma that is engaged. That's a different set of circumstances to what we might class as a long hauler or a long COVID of someone who was previously fit, wasn't hospitalized, had lower levels of severity of symptoms, but since being symptom free, has now started to experience varying levels of debilitating levels of fatigue and other issues and complications in the wake of those lower symptoms that didn't require hospitalization. So all the way through, we are going to see increased numbers. And even when the vaccine comes about, and there's a statement on here in a moment with regards to the vaccine, even when that's available, there will be time for the administration of the vaccine, and the vaccine will function and perform the way most vaccines do. So this does not make an entire population immune. It lowers risk. But what it also means is that by then and within then, more and more people are going to contract COVID-19 and are going to need support with their restoration and rehabilitation.
When it comes to the UK landscape, we've been tracking the COVID, let's call them for the sake of this conversation, hotspots over the last few weeks. 3 weeks ago, the white circle there with the 29 in, 3 weeks ago, or about a month ago, we were all very much focused on these tier 3 locations. So primarily Lancashire, Yorkshire, Greater Manchester. Those 29 locations cover those 3 areas of the UK. A week later, 7 more regions in the UK were added to these hotspot areas. And it's worth pointing out that those new areas that appeared on the government heat map as a hotspot weren't necessarily a county or a city next to a county or city that was already considered a hotspot. We expect some organic bleed over counties as the virus spreads. But for example, when that +7 arrived, Staffordshire was part of one of those new +7 territories, which admittedly isn't a million miles away from Manchester or Lancashire, but it's certainly not next door. This week, another 14 locations have been added to that list. And again, we've seen Leicester pop back up as a hotspot, Derby pop back up. 2 weeks ago, the North East, Newcastle upon Tyne, Stockton, Middlesbrough, they weren't even a hotspot area. But now hotspots are popping up more sporadically, and the rate at which they're appearing in the country has increased. When we talk about these hotspots, and you guys can take a look at the government heat map of COVID at any time, it's available on the internet. When we look at those hotspots, they're like a purple colour on the map. And anything that sits beneath the hotspot but is also a high-risk area is like a dark blue. And then it goes into a series of lighter shades of blue, and then green, where the virus is less impactful. It's also worth highlighting in the last week, almost all of the rest of the UK that sits, and certainly England, that sits outside of these hotspots, is 80% of it is now dark blue. Whereas before, the dark blue just surrounded these most prolific areas. So the point of this slide really is just to explain, to Cole's point, the rate of increase is rising, but also what we're able to do as a sector, and with the knowledge and the access to information that we have, we're able to look at what parts of the UK are being most affected and where most of the people are who are currently dealing with COVID-19 and long COVID, where most of those guys live. When it comes to individuals who have endured COVID-19 and those that are living with long COVID, this video explains a little bit about what you can expect when you're faced with someone who has experienced the virus. The video is a few minutes long, so we'll leave this to play for you guys now.
It's called a novel virus, which means it's new to all of us.
Hi, my name is Charlie Peters. I'm 30 years old and I'm currently living in northwest London. I'm a professional Muay Thai fighter with over 13 years experience, but I'm currently transitioning over into endurance training. I'm working my way to a half Ironman later this year. I've had 67 professional Muay Thai fights, former 3-time world champion and the current UK #1. So I work at various gyms around London, taking group fitness, as well as personal training individuals to teach them boxing or Muay Thai. I cycle quite a lot around London and I'm always on my feet, walking anywhere and everywhere that I can. So I'm very, very active. So I got COVID.
I was having my 60th birthday on the 3rd of April. And so from the beginning of January up until then, I was on a mission, and I was absolutely determined I wasn't going to hit 60 feeling less than my best self. So, you know, swinging 16K kettlebells and running around and doing all sorts of, and bouncing about, feeling as fit as a fit thing. I got back down to my fighting weight. I went to the supermarket at 7 a.m. and I think I got it there.
Hi, I'm Kate. I'm 38 from Warwickshire. I contracted COVID around mid-March. I'm now 19 weeks post-COVID.
So one thing I remember clearly from COVID is feeling at how fatigued I was. I literally didn't do anything all day, but I just felt exhausted.
It's knowing what fatigue is. It's different to tiredness. I felt absolutely fatigued, absolutely completely wiped out. Breathless going upstairs, total fatigue, absolutely wiped me out.
My initial symptoms were very flu-like and lasted only around a week. But the hardest part of it was the 3 weeks after that. And I really did feel super fatigued, really struggled actually to go about my daily business. And that was quite difficult. I'm an at-home mum of 2. There was a moment where I was quite afraid. The effort on my lungs was quite intense.
But I noticed my heart rate just shoot up. And even if I tried to run really slowly, my heart rate would stay high. I've done a lot of sprint work. Heart rate is a clear indication of how much stress the body's taking. That's when I knew something was quite serious. I was more so frustrated mentally. I'm so fortunate that, I've been okay.
My heart doesn't skip a beat normally, but I could feel my heart thudding in my chest, and I felt fatigued for 2 or 3 days afterwards. My neck I could feel my pulse in my neck. My head felt it was going to explode. After that took me really downhill.
Maybe I trained 4 times, maybe 5 times a week before. I do a lot of resistance work, mainly circuit-based. If I do any cardio, it is mainly on the biking side. Initially, just getting back on the biking side was really, really difficult, and I couldn't maintain long sessions.
So clearly I'm not unusual. There's quite a lot of people who are going down that road. All consuming, and just to walk downstairs and get a cup of tea was exhausting. And by the way, during the night, I've had this really, really weird pain in my head, and my cheek feels numb. And she just said, you've got to get an ambulance and get yourself to hospital quick, because you might be having a stroke or have had a stroke. They've said I've got some mild neurological nerve damage. If you go to a class and say, right, well, we're going to do an EMOM, every minute on the minute. I don't think my brain could actually process that as well at the moment. I'm really scared to start again, because I don't know whether it's going to trigger it off all over again. But I don't want to not start again, because I want to get back to myself. But I don't know when the right time will be to start.
It's not really how much you do. I think it's probably short and steady wins the race with this kind of thing.
So that can be as simple as a 5-minute walk on a treadmill, and at a given pace, at a given kind of incline, and it's just see how the body responds, and almost
try and figure out what kind of resources we'd need, what kind of testing we need, what kind of staff we'd need.
So at least I'd say about 8 to 10 weeks since I've been feeling better. You get to learn your body in a different way, in a different manner. My body's never been through something like that. I've never been through it mentally and physically. So I feel like I've learned a lot more about myself. I've been extremely lucky. I've been extremely, extremely lucky. What you learn about yourself going through a battle like that is an amazing thing to happen. But I've been very fortunate, very lucky in comparison to many other people. So my thoughts are with them, definitely.
Because it never stopped. It never bottomed out. Without a vaccine, we are looking at a very different world for the next 2 or 3 years.
We need a new normal for everything, don't we?
So huge thanks to Charlie, Jan and Kate for sharing their accounts of COVID-19 with us. It's worth highlighting that we recorded those videos with the guys back in June. We're now obviously into November. Sadly, all 3 individuals are still feeling the impact of COVID-19, broadly because of post-viral fatigue. What is also worth noting is, whilst all 3 of those individuals have been through a roller coaster since March in terms of their health and well-being and state of mind and so on, what they've experienced is quite common. I think when we all talk about COVID-19, very often the first things that come to mind are a loss of taste, smell, a fever, period of isolation at home, a dry cough. And I think it's not really until you're exposed or loved ones or friends and family have COVID-19 that you can see how that looks, or the full spectrum of COVID-19 symptoms with an individual. So as I say, what these guys have experienced is relatively common, but it's certainly not the most extreme version. Col and I and the team here, we speak to individuals every day, and we're part of groups that contains literally tens of thousands of individuals who are experiencing COVID-19 and long COVID, whose symptoms are so wide-ranging and very extreme and quite drastic in some instances. Just yesterday, just to provide some context, we spoke with an individual, a gentleman, he's 46, he contracted COVID back in March. Today, he still is unable to walk to the end of his road and back without stopping, and he has to carry an oxygen cylinder with him. Previously, as with these guys on screen, completely fit and well. So Carl is going to talk through some statistics that speak to the different types of symptoms that an individual who is dealing with COVID-19 might accept.
Thanks, Mel. Yeah, this is data that was published in the summer, which came from Professor Vo over in the States, and it was to give an insight as to what was happening in the US at the time. But we had a very similar pattern of behaviour over here in the UK, and it was really to make the point of what's the reality for most people. But I want to frame this within the context. If a lot of people approach us and say, well, this is a novel virus, so if it's a novel virus, how can anyone know what to do about it? I think the first thing to point out is that there's been a real acceleration of understanding since March. There's been a heap of research that's gone on around the world, and the UK has been a hothouse of that, particularly down in Oxford. So there is a lot of emerging data. Originally, we had this notion that the way the COVID-19 functioned as a virus, it prioritized the respiratory system and attacked the alveoli. Now we know that actually it doesn't necessarily always work that way, that it can go to cardiac tissue, it can attack the hemoglobin in the blood, it can go to other various parts of the vital organs and even the neurological system. So this really starts to capture that. So for every single one person who died, who was hospitalized and died, this is data from the summer, a further 19 will require hospitalization. 18 of those will have permanent heart damage for the rest of their lives. 10 of those will have permanent lung damage. 3 will have a stroke. 2 will have neurological damage that leads to a chronic weakness and lack of coordination. And 2 will have neurological damage that leads to loss of cognitive function. So we know lots about all of these areas. With regards to cardiac rehabilitation, neurological rehabilitation, COPD, pulmonary rehabilitation, we know lots about that. We know lots about the type of tissue trauma, the type of cellular trauma and damage that can be sustained, and we know lots about how to effectively recover people. What we've never had to deal with is the scale of massive people from the lowest levels of potential interference through to the more severe cases as described here. We've never had to address that on a societal level previously. Hence why I return to my argument that the infrastructure we require nationally is already in place, and it's the gym operators that have that infrastructure. The skill set that is required, which is to meet an overlap with acute clinical care, already exists. It's our PTs, it's our coaches. We need to just upskill them so they're familiar with the language, the contraindications, the limitations, the things to be concerned of, but more importantly, to know exactly what to do, to start to support people towards meaningful outcomes so that they can effectively restore and recover. So yes, it is a novel virus, and we have all been drawn towards those mortalities because any one death is a death too many. But the reality is this, and this is purely with regards to the hospitalizations. And as we've seen in that video, previously fit people who don't require, thankfully, hospitalization have been left with long levels prolonged periods of interference with having to overcome those symptoms. And that's because we can't look under the hood and see exactly how the virus has affected them. But there is clear indications with regards to the symptoms they report. And what we need to be able to do is effectively manage each individual based on the types of symptoms that they're demonstrating.
And as Carl speaks to there's a whole portion of people, as we know, that aren't hospitalised. In the video just seen, Jan has been in and out of hospital for tests and x-rays and so on, but never hospitalised for a prolonged period of time. And we know, or the advice we're given is, if we start to show signs of symptoms, isolate, self-medicate, stay home. Thus, the vast majority of the population that weren't hospitalised have tried to figure out themselves how to make themselves better. So these groups that I referred to that we're involved in, where people are talking about their experiences with COVID, they're trying to self-prescribe their own way out of their situation. There's chats on Facebook where they're recommending one another does certain types of exercise activity, or they're talking about supplements and recommending those to one another from sources that may not have been filtered, or they don't necessarily completely understand context around that supplementation, etc. But because they have no other resource to go to for help, they're clinging to whatever options and whatever information they can find, because they're starting to lose hope, because they're not feeling any better and they're not progressing. So what we're finding is these individuals that are trying to self-prescribe their way out of their own situation, not through any fault of their own, but they're ill-informed, they're actually making their situation far worse. And in most cases, they're making themselves sicker and they're prolonging their recovery period. Colin and I love an analogy, and one that we've used just recently when we have spoken with people who've got COVID-19 and they don't look at a necessary restoration period after their initial acute phase, and they try to return to normal daily life, or in some instances return to physical activity and fitness. It's akin to breaking your leg and then trying to go for a run. That's what people are doing when it comes to trying to return to normal life too soon post-COVID. You can also look at this in the general sense of fitness. We're all on the same page in terms of the fact that we as an industry provide necessary guidance, instruction, programming, strategies for individuals for better health and for better fitness. And we know that the vast majority of the population out there still tries to fathom that out themselves without a gym membership or without the involvement of a personal trainer. And they don't get the results that they want to see because they're not armed with the right information to be able to get themselves there. It's the same situation, but in the context of COVID-19, and a lot more is at risk. So, as Col explains, we as an industry have the infrastructure and we have the workforce to step in where they don't have that knowledge and experience and resources. So when Col and I first started out as CAWS earlier this year, we never wanted to purely be an education company. We always wanted to have a much bigger impact on our sector. And in the context of COVID-19, that looks like this. So our goal is to work with ukactive and our other strategic partners, Active, Club Industry, and the other brands that are working closely with us, and club operators, to grow the skills registry of personal trainers and coaches that are confident and competent and are equipped with the right knowledge and skill set to be able to rehabilitate individuals from COVID-19 and long COVID. When we first started chatting with Dave and the ukactive team back in May, our conversations were quite practical by nature, in the sense that we have a problem here, we as an industry can step in and solve it, let's provide a training program so that the workforce can step in and provide this service to communities. But since then, certainly in the last month or two, and as we as a business have been more exposed to those bigger groups of people that need help, for us, this has become much more than a course, and it's become more than a training program for coaches. A massive part of what we're focused on now is just helping more people like Jan, Charlie and Kate, and in particular, those who are in a much worse position. So how do we start to make that all happen? So where the skills registry button is in the middle of the screen, if you consider that to be a certified coach that has the relevant experience to rehabilitate someone from COVID-19, how they then employ those skills within their local community and within their role as a coach is as follows on this slide. So as a club or a coach, there are going to be existing clients or members that have experienced COVID-19 or who are enduring COVID-19. So there's an opportunity for clubs and coaches to let their immediate member and database know that they are a local resource for help if you've experienced problems. There's also, top right, a whole group of newcomers that may or may not have had a relationship with exercise in the past, most likely haven't had a gym membership before, that are struggling in exactly the same way. So there's a role that we can play in our local communities to let those individuals know, again, that someone local to them has the right skill set to be able to help them at this time. There's also a new type of relationship that we can forge with our local general practitioners, primary care groups, community rehabilitation groups, to identify who in our communities is struggling with COVID-19 and receive those patients coming out of the acute phase. Chris will speak to this in a short while as well. Chris connected with his local GP early on, who then signposted Chris 15 individuals who have endured COVID-19 directly. Similarly, bottom left, corporate. We've looked at corporate outreach since the dawn of time when it comes to generating members for our clubs or clients for personal trainers. This is a different type of conversation that we can have now when we knock on those doors. Take Jan as an example, who you saw in the video. It's not uncommon for someone who's experienced COVID or long COVID to be in a situation where they're performing poorly at work. They struggle with attention spans, reading emails, poor sleep. Where they are able to go to work, they struggle with commutes to drive to work. And even what would be considered a mundane work task previously can tire a person out for days. So employees are stressed that their performance is majorly under review. They're worried about losing their jobs. They're on long-term sick pay. And similarly, the employers have got staff out on long-term sick pay. So there's a role that we can play as a sector with the employers to rehabilitate their employees from within. Similarly, it's not on this slide, but we've also received calls in the last couple of weeks from schools who've got students who've endured COVID-19 and they're not sure what to do and want to be able to provide some rehabilitation to those guys. So again, that's where we can step in as a sector and work with those school facilities. And I know, of course, that there'll be some people on this call who have a dual use facility, in which case you can facilitate that from within. So the point I'm making with this slide is more than ever before, the club and the role of the coach becomes the centre point to solving this situation across all aspects of our community. Carl's now going to explain a little bit more about the structure around the training program that we've created that teaches trainers and coaches where to start and beyond. How it is that we've structured it this way, a rough idea of some of the content that's in there. And also, whilst you mentioned this a little bit earlier, we are asked the question a lot, if it is a novel virus, how do we know what to include in a training program at this stage? So Carl's going to address that question in this section.
Yeah, thanks, Mel. So going back to, again, that notion, first of all, is because of this novel virus implication. So it's really important to note that we know much more about the virus now than we ever did, and we're gaining more information all the while. The way we structured the curriculum was with mindful of the fact that we would need to develop it over time and that we'd have to update content as we found out more, particularly with regards to how the virus functioned. So it's a spiral curriculum. So everything from where we begin with assessments through to how to assess, to progress, how to effectively monitor, looking at the pathology, what we know about the virus, how it affects the system, the damage that that can lead to, all the way through to how to effectively exercise, prescribe, manage expectations, looking at nutritional factors with regards to how to optimize restoration and recovery again. So we carry the learning throughout the curriculum, because what we didn't want to do was put something in place where a person, a learner, would have to go backwards lots to retain information, that we carry that information, that understanding and knowledge all the way through to the final point of that program. So it lends itself inherently towards being able to update it in key sections and modules that we can remove and reapply them with that nature of that content. What a person needs to bring to it, I guess, is a certain level of their own experience and expertise as a PT or coach, because we're going to build exactly and directly upon that. So it's adding to that skill set. It's broadening that repertoire, giving them greater confidence, particularly from a language point of view, understanding those implications and being able to have conversations with medical and clinical experts and leads, so that there's an understanding on handover. Because it could be that a coach or a PT is taking a patient or a person directly from quite an acute setting. More commonly, they're more likely to come from a community rehab setting, or the biggest population are going to be those people who've experienced neither and are reaching out and looking for help. But it's really important, and we embedded this right throughout the program, that there is that understanding of the language and the key implications and how we can develop that all the way through. So yeah, as it stands right now, it is as up to date as anything we know about COVID-19, how it functions and what we can do about it. But the plan has always been to evolve that program as we go through and learn more.
In terms of how, just to give you guys a bit of an insight into the structure of the course itself, we open up by outlining the fundamentals of COVID-19. So the pathology of the virus, what changes it causes to a structure of an individual, that's laid down in very detailed and explicit terms at the front end, so that the guys have a better understanding of what they're dealing with when they're working with someone with COVID-19. We'll then introduce and layer up a series of testing protocols that are best recommended to use with someone who's dealing with COVID-19, and we'll coach the guys through how to administer those, how to translate the data thereafter, how that data should then inform the early stages of exercise prescription, then exercise programming for the medium to longer term, and then how that then seamlessly flows into either a fitness routine that they're more familiar with if they did have a relationship with fitness before, or it's a segue into a whole other fitness and exercise experience now if they didn't have a previous relationship with exercise before. There's also a whole ton of information in there around how you can bolster that baseline with nutrition or other healthy lifestyle behaviours that will be common to us as an industry, but framed slightly differently here and in the context of COVID-19. And there's also specific sections in there relative to how the landscape has changed for us all during COVID-19. So remote training with an individual, working with the over 70s, and the fact that they're more vulnerable to COVID-19 and so on. Mr. Dave Alstead also has his own cameo in there. Dave and Carl speak for a bit of time to talk about the impact that COVID-19 has had in the wider commercial and business aspect of the industry as well, because we wanted to make sure that we provided a complete picture for the guys and a real 360 as to what was going on.
Sorry, Mel, before you move on from that, I think it's important to emphasise, though, because I think where some programmes in the past have kind of not really delivered is that it is designed to be empowering and encouraging. So it's identifying the issues, but all of the emphasis is placed upon what we can do about it and how we can lead these people towards measured success and continued success. I think all too often it's easy to get scared by the pathology. It's really easy to scare people and start to treat people as though they should be wrapped in cotton wool or like they're walking on glass. And we've worked hard to avoid that scenario. This is to be mindful of the challenge, but to upskill someone and give them every available tool and asset to be able to overcome those challenges.
Yeah, good point. And also on that, because, and I've said this several times already, because the spectrum of symptoms that someone's going to experience is so wide ranging, it would be impossible to spoon feed the guys through this training program. So as Cole says, it's heavily focused on concepts and principles that can be adapted and applied to every type of individual that could be coming through the door. And also so that it's not looked at in like a contained 4-week, 8-week, 12-week perspective. It's not like a short-term intervention. It's understanding the broader context so that it could be a long-term relationship that the club or individual has with these guys. In terms of then, if a club or a coach goes through the certification, now equipped with this new skill set, what does it mean for the business side of what it is that we do? We've shared a few bits on this slide, which these have come from conversations that we've had with either independent trainers or clubs in the last few weeks as to how they see it fitting in. So the obvious top one is the community, well, top two, the community aspect that we talked about, becoming the local resource centre bang in the middle of our communities to help every type of individual in an entirely new way, whether they're a member or not, is huge. It also speaks volumes and is a further reason why government should not be closing our doors as facilities if it is us that are providing the solution to those who are struggling and those who are unwell. So clearly that's a massive part of our role in this entire COVID-19 situation as a whole fitness community. Other groups are looking at embedding this rehabilitation program into their club services as a retention tool for existing members so that they can see added value and another reason why they would want to be part of their gym community. It's also in that same frame of mind, another way that we as an industry lead by example and highlight the knowledge that we have as a sector. As we spoke about before, this is an opportunity to generate new leads as businesses as well, if we are going to be a resource for newcomers. I should point out though, when we have had that conversation around opening the door to new groups and lead gen with some clubs, where capacity is still an issue, especially during government restrictions, some clubs are nervous about, do they want to really create this big queue of newcomers when capacity internally is compromised and frankly members are already a bit pissed because they can't get into certain classes and access certain services and so on. So in those events, what we've talked about is, since the vast majority of clubs have made a pivot towards different digital services now, and because we built the training program with future lockdowns in mind in any case back in the summer, it is possible to deliver COVID rehabilitation, as Chris does currently, digitally to individuals, which means that you could incorporate that into the digital side of your business, rehabilitate people through those means, which then means hopefully when things start to return back to normal, we're able to return to normal capacity and open our doors as we would normally, that then we've already developed a bit more of a pipeline with these newcomers whom we've been working with digitally that can then start to physically come into the facility. So I just mentioned Chris there. We saw this slide before. I've just popped this slide back up, and as you'll see, I've popped Chris's name in the middle, so that Chris can kind of speak to his own experience of how he's been fitting into this scenario within the groups that he's been speaking to. Again, just to preface it real quick, Chris has been in the fitness industry for kind of 20-25 years or so. He graduated from Rebuild just a few weeks ago, and already in that very short space of time has acquired 18 new individuals who he is helping. They've come from either people in his community, people who he has identified through the relationship that he has with his general practitioner, or it's through people that we've spoken to collectively as a group who have got COVID, who are losing help, wanted some support, and we signposted those guys to Chris. Dr. James was supposed to be joining Chris on today's session. He's busy saving lives. So I will hand over to Chris on behalf of both of them. Chris is going to speak to his experience of the course, the sorts of conversations he's had with COVID patients, and how he expects to weave what he's just gone through into his career going forward. Over to you, Chris.
Thank you, Mel, and thank you to Dr. Cole and to Dave for letting me speak today. It's been good, really good so far. Hopefully you can hear me all loud and clear. I'm sure Mel will wave her arms frantically if you can't. The course that I went through was fantastic, and it's an opportunity for me to get back to something that I loved doing sort of 15, 20 plus years ago. And having just a little bit of background, having started a consultancy back in February, you can imagine how that took off, i.e. it hasn't. And so really this was an opportunity for me to learn something new and sort of get back in touch with a passion of mine, which is helping people one-on-one. The course itself runs at a really good pace, and I don't mean that to mean fast. I mean the ideal pace of high quality scientific research-backed information from Dr. Cole, but also attributing and trying to sort of map that out into the real world when we're dealing with people from across society who are really struggling. It probably took me, I think probably 4 to 5 weeks to get through all of the content. Most of it is video of different durations, and you make as many notes as you like. After which I took the assessment, and what it gave me, as much as anything else, yes, there's a lot of new information in there because it's such a new phenomenon that we're going through. But it gave me a little bit of more of sort of solidifying my understanding of how exercise can fit into this, and a little bit of refreshing as well, because I hadn't done some of this stuff for a long time. But I mean, overarching was the confidence that I then had to go forward into my community via James, Dr. James, and start to map out that network that was going to allow me to support the wider community. I live in a town called Farnham in Surrey, and it has 60,000 inhabitants. It's in a relatively low to a very low tier risk at the moment. However, it is rising, and I can tell you this as a matter of fact, because I contracted COVID on Monday, and I'm very, very thankful and fortunate that my symptoms are extremely low lying, but I'm not kidding myself that I think that I can go and do a 100-mile bike ride once my self-isolation lifts, because I know that I'll need to get out of it very gradually. However, I know that it's not the same for most other people who've contracted it, and certainly those who have long COVID, they simply don't know what they need to do next. I'll come on to those people in a second. But the way that myself and James initially contacted each other was because he's a dad at my kid's local school as well as being my GP, and we immediately made that connection when I started talking about the qualification that I was doing at the time. I hadn't yet finished it, and he said, I could give you 12 to 15 patients of mine already who have experienced long COVID, are going through long COVID, don't really know what to do. I can't give them direct support because of the workload, and I would love to give them to you. So once we'd generated a formal relationship and he understood more about the course, understood more about the accreditation so that he can go to other clinic managers and in his practice manager as well, explain about the accreditation and the credibility behind the qualification, it then became clear that his professional network was very happy to support him in referring across to me. And that meant that almost overnight, I started working with people initially exclusively on a one-on-one basis, but now remotely rather than face-to-face because of my condition. And the feedback and the initial conversations and assessments that I do, stemming from my qualification, give almost, a blanket consistency of result. That being that they have had experienced acute symptoms for the first 2 or 3 weeks or however long it was, after which came a sort of flood of fatigue and a road that doesn't seem to have an end in their mind. And that is something that they are battling with. And it seems that the longer the road is, as consistent as the physical challenges are, the mental and emotional challenges seem to be the most prioritative ones at the moment. And this is where these guys and girls are really struggling. So for me, just to wrap up, it's an opportunity to give back, and it sounds a bit corny, but that's what I'm extremely keen to do. It's an opportunity for me to help these people through this journey, and with making some quite assertive but very, very simple prescriptive measures with those people, and then we can get them out of this. But the key thing is, and this is where Mel will probably go on to now, is that it's just me. At the moment, it's me in a small town of 60,000. We probably need 50 people in my town alone, let alone these hotspots, let alone these larger communities, bigger cities across the country. So an app won't do it, a 4-week course won't do it. It needs to be contact, it needs to be communication, ongoing, daily, weekly, whatever it takes with these individuals who can't quite do it on their own. And that's where I come in, and hopefully more people like me.
Thank you, mate. I couldn't have put it better myself, in terms of we need more people. I said before now, this isn't about a training course for us anymore. It's about getting more Chris's to connect with the tens of thousands of people that need help. And illustrative of that is, as I said before, any individual who we've spoken to and offered up the help of Chris and any of our other certified coaches have all said yes without question to the support. So if you guys are watching this and as a facility or a coach, you're interested in how you can join what it is that we're trying to achieve, this slide will quickly break that down. So the Rebuild program that Colin and I just spoke about is available now, and it's all online. Built in part because we were expecting more government restrictions. There is also live Q&A tutorials in there that are either hosted by Col or any of the other subject matter experts that feature in the program. It's built also with the same thought process in mind, that it could be delivered by coaches in the gym, or in the event of government restrictions, it can be delivered remotely or to a person who is at home. Any UK active members automatically receive 20% off the training program, and a contribution from every monthly membership is reserved to fund projects for vulnerable groups and research projects and similar that go towards rebuilding the fitness industry. That was very important to us from the start. On average, it takes an individual 30 to 45 days to get through all 61 videos. If all you did was eat, sleep, train, and watch the videos, which I had to do as part of this process several times, you could get through the content in 14 days, but realistically, it takes most people around 30. However, we recommend that around 10 days into the program, once clubs and coaches have got their head around the bulk of the content, you can already start to reach out to your local communities, your local general practitioners, to let them know that you are getting equipped and you will be ready to receive people within a month. Once one of the learners has graduated from the course, we list them on the CAWS registry of graduates, as Chris is. So as we are doing a lot of the grassroots and the groundwork as well, and we are approached by individuals, which we are, who are looking for help, we can determine where they are in the UK and connect them with their nearest rebuild facility or rebuild coach. In some instances where we have issues around capacity or clubs and trainers can't take on those individuals, that's where the remote care can also come into play. There's a third course. There are 3 courses available within the CAWS membership, which of course we haven't got time to go into too much detail about today. The third course, Fortitude, focuses on how to work with what we have commonly referred to as vulnerable groups during COVID-19. So we recommend that when an individual has completed rebuild, they go on to complete Fortitude, as Chris has done. And as Cole said previous, when we set this up, we wanted to make sure that we gave clubs and coaches the freedom to come and go as they choose. So once the initial 30 to 45 days are complete and the guys have gone through the content and certified, it is possible to cancel your membership and just crack on and deliver the rehabilitation program in the community, or you are able to maintain your membership and then get access to all new content and research as it emerges, keep it as a reference point, move on to the courses. Whatever you guys feel that you need, we wanted to make sure that we provided the options, again, because we're very aware of the fact that everybody's dealing with other commercial challenges outside of this health issue. Very conscious of everybody's time, so I will stop talking and stop sharing screen and take a look at any of the questions that we might have been posed that Cole might have not answered already. Unless there's anything else that Cole you would like to add. You're on mute, you're on mute, you're on mute.
I've actually been answering the questions that have been popping up in the Q&A box, so hopefully I've addressed everything that came in there, and thanks for those questions. But no, if there's anything anyone would like to ask now, we've got a bit of time to go through anything. Any concerns, questions, queries?
We'll give it a few minutes in case anybody wants to ask any questions. I'll have a quick look at what came through before as well that I couldn't see on screen in case there's anything to add after, and then we can come back to you guys subsequent to this. Dave, as someone who has heard a lot of that content multiple times, dating right back to May, is there anything else that you would add?
No, I think it was expertly delivered by everyone on the call today. Thank you very much for that. I think I would just urge everybody to just find out a little bit more about the course, find out how it can support, specifically operators on the call, support your frontline workforce in upskilling themselves and feeling confident with ultimately receiving what is going to be inevitable as we emerge from the lockdown, really.
Thank you, mate. Okay, feel free to fire through any questions. Otherwise, as Dave explained at the front end, we'll make today's presentation available online after today if anybody needs to share it with colleagues or revisit anything that we went through. Otherwise, drop us an email or any questions afterwards, and stay safe, guys. Thanks for listening and have a great weekend.